Uwe Reinhardt is an economics professor at Princeton University who studies healthcare. He joins us on the phone right now from Princeton. Professor, thanks so much for being with us.
Oh, my pleasure.
Now, I know that you support this bill, but surely there is some validity in the argument that you've heard from the critics of this bill that this is really not reforming the healthcare system. It's basically expanding it to those who are uninsured right now.
Well, yes, of course, but that is in itself a reform. I mean, it's very easy for people who are well insured smugly to say giving that same privilege to others is not reform, but that is reform, and it's a historic reform. What they are talking about is reducing healthcare spending and making sure we get better value for the dollar. But let me remind you, every time you try to do any of that, the Wall Street Journal goes apoplectic and talks about rationing and depriving the elderly of health care.
Right.
So, I mean...
And breaking the bank, bank.
Well, no, but when you reforming health care is actually a code word for reducing healthcare spending. But everyone's healthcare spending is someone else's healthcare income. And the people who book health spending as income, doctors, hospitals, drug companies, and so on, they are resisting every inch of a campaign to reduce their income. That's only natural. So that'll take a decade to do. No president, not even the Pope, could have reduced health spending within the next 5 years.
Right, because, well, I mean, Professor, one of the big criticisms of this is that it hasn't reformed the way health insurance companies operate, that they are still going to make a whole lot of money in ways that, that certainly critics of the current healthcare system have said is unfair.
Oh, no. This is not, that comes from the left, this kind of attack. The health insurance industry really has two components. One is the large group market that sells to employers or simply just administers claims for employers who self-insure. That's one industry. The other industry is that sells individual policies or to very small business firms, gas stations, bakeries, and so on. Mm-hmm. The latter industry will be drastically reformed. And in fact, a lot of their administrative costs, at this time, that industry burns up to 40% of the premium you pay in administration, marketing, and profits. They won't be allowed to burn more than at most 20%. Their profit margins will not be regulated, but they'll have to compete. And the margin now isn't so big. Insurance companies don't make billions and billions of unearned money. That's just not true.
So, Professor, but ultimately you're saying our premiums will absolutely go down and the health insurance companies are not going to make excessive amounts of profit from those premiums.
Well, I mean, premiums going down is a very tricky issue. If you're a very healthy young person, you may see your premium actually go up because you will now be put into a pool with older people and your premium will help pay for some of their health care. On the other hand, if you're an older or sicker person, you will see your premium come down. Why? Because younger persons will help pay for part of your health care. That'll be the new social contract. That's the social contract every other nation has. So, yes, if I pick only young people, it is possible that in spite of the administrative cost savings, their premiums might go up. That is the new social contract. It has to do less with economics than with ethics, really.
And part of that, an addendum to that, Professor, is it not, is that if you're sick, if you have a pre-existing condition, your premiums don't change. Is that right?
They won't change, nor will you, in fact, be charged extra for that now if you hadn't been insured. See, that's just it. In a new world, the individual's health status cannot be factored into that individual's premium as it is now. But then, of course, that means sicker, chronically ill people will see their premiums come way down. But young, chronically healthy people will see their premium rise.